81. Which part of the ECG tracing reflects repolarization of the ventricles? A. P wave. B. QRS complex. C. R wave. D. T wave. Answer: D. T wave. Explanation: the T wave reflects repolarization of the ventricles. 82. The length of the normal PR interval is A. 0.04 to 0.12 seconds. B. 0.12 to 0.20 seconds. C. 0.20 to 0.28 seconds. D. 0.28 to 0.36 seconds. Answer: B. 0.12 to 0.20 seconds. Explanation: the length of a normal PR interval is 0.12 to 0.20 seconds, or 3 to 5 small boxes on the ECG strip. 83. A 3-year-old female is unresponsive and not breathing. Parents state that she was eating grapes when she suddenly made a high-pitched whistling noise and turned blue. Your immediate action would be A. Provide back blows and chest thrusts. B. Start cardiopulmonary resuscitation. C. Perform endotracheal intubation. D. Perform abdominal thrusts. Answer: B. Start cardiopulmonary resuscitation. Explanation: the high-pitched whistling noise and cyanosis indicates the patient is suffering from an airway obstruction. Back blows and chest thrusts are performed only on infants. Since the patient is unresponsive, your immediate step should be to start CPR. Abdominal thrusts are performed only on conscious choking victims. For unresponsive victims suspected of having an airway obstruction, you should begin CPR, but look in the mouth to see if you visualize the object prior to each ventilation attempt. 84. While assessing a patient complaining of difficulty breathing, you note an altered mental status, stridor, chest tightness, and tachycardia. Based on these symptoms, you should suspect which of the following conditions? A. Cerebrovascular accident. B. Emphysema. C. An asthma attack. D. Anaphylaxis. Answer: D. Anaphylaxis. Explanation: stridor indicates an upper airway obstruction, in this case most likely from an allergic reaction. A patient with emphysema would exhibit difficulty breathing with wheezing and rhonchi. A patient with asthma will exhibit wheezing respirations. A patient suffering from a CVA would have an altered mental status, but would not have stridor. 85. In a patient with ventricular tachycardia, the QRS complex is A. Absent during the cardiac cycle. B. 0.04 and 0.12 seconds in duration. C. Greater than 0.12 seconds and bizarre in shape. D. Shorter than 0.04 seconds and flattened. Answer: C. Greater than 0.12 seconds and bizarre in shape. Explanation: patients with ventricular dysrhythmias often manifest lengthened and bizarre QRS complexes. 86. A patient with non-perfusing ventricular tachycardia would receive the same treatment as a patient with which other rhythm? A. Ventricular fibrillation. B. Perfusing ventricular tachycardia. C. Atrial tachycardia. D. Asystole. Answer: A. Ventricular fibrillation. Explanation: treatment for both conditions consists of immediate defibrillation. Continued treatment includes CPR and drugs. Additional therapy depends upon whether a normal rhythm is initiated. 87. Which of the following indicates that an AMI patient is developing cardiogenic shock? A. Increasing pain. B. Narrowing pulse pressure. C. Falling blood pressure. D. Sinus bradycardia. Answer: C. Falling blood pressure. Explanation: falling blood pressure, especially a systolic pressure lower than 80 millimeters of mercury together with decreasing level of consciousness, is a sign of cardiogenic shock in an AMI patient. Reflex tachycardia may develop as the patient's body attempts to compensate for the shock. 88. Which of the following are signs and symptoms of right-side heart failure? A. Tachycardia, peripheral edema, and jugular vein distension. B. Bradycardia, carotid bruits, and falling blood pressure. C. Respiratory distress, hypoxia, and cyanosis. D. Chest pain, pulmonary edema, and anxiety. Answer: A. Tachycardia, peripheral edema, and jugular vein distension. Explanation: the classic signs and symptoms of right-side heart failure are given. 89. Which of the following is often the first sign of the onset of the development of a potentially lethal dysrhythmia in an MI patient? A. Changing pulse rate. B. Increasing pain. C. Loss of consciousness. D. Narrowing pulse pressure. Answer: A. Changing pulse rate. Explanation: a change in the pulse rate may be the first sign that a dysrhythmia is developing. This is why recording baseline vital signs is particularly important. 90. Why are easing anxiety and relieving pain considered major goals for pre-hospital care of MI patients? A. The onset of either may signal the development of a lethal dysrhythmia. B. Anxiety and pain often mask underlying symptoms of cardiogenic shock. C. They may prevent the patient from cooperating with additional treatments. D. Both anxiety and pain increase heart rate and myocardial oxygen demand. Answer: D. Both anxiety and pain increase heart rate and myocardial oxygen demand. Explanation: anxiety and pain can increase the heart rate and, therefore, the oxygen demand of the myocardium. 91. Dopamine can be used to: A. Decrease oxygen demand. B. Increase cardiac output. C. Reduce blood pressure. D. Prevent dysrhythmias. Answer: B. Increase cardiac output. Explanation: dopamine is a potent sympathomimetic agent, and in cases of cardiogenic shock, it may be used to increase cardiac output. 92. A patient is short of breath after impact with the steering wheel in a motor vehicle crash. Breath sounds are diminished on the left. Which of the following conditions is most likely the cause of the patient's complaint? A. Simple pneumothorax. B. Tension pneumothorax. C. Pulmonary contusion. D. Cardiac tamponade. Answer: A. Simple pneumothorax. Explanation: the question does not provide any indication of a tension pneumothorax. A pulmonary contusion or cardiac tamponade should affect lung sounds. 93. Which of the following is a possible cause of pulseless electrical activity? A. Right side heart failure. B. Tachycardia. C. Hypovolemia. D. Hypokalemia. Answer: C. Hypovolemia. Explanation: pulseless electrical activity may occur secondary to a variety of conditions and carries a grave prognosis. Common causes as listed in the AHA-PEA algorithm include pulmonary embolus, tension pneumothorax, acidosis, cardiac tamponade, hypovolemia, hypoxia, hypothermia, hyperkalemia, AMI, and drug overdose. Hypokalemia may cause dysrhythmias, but does not usually cause PEA. Tachycardia is not considered a cause of PEA simply because the definition of PEA is a pulseless patient with a rhythm that you would normally expect to find a pulse with. In other words, tachycardia without a pulse is PEA. 94. Some treatments for suspected MI patients mask the elevated cardiac enzyme levels that are used to diagnose MI in the hospital setting. To prevent this, you should not administer: A. Transcutaneous pacing. B. Any drugs via the IM route. C. Any nebulized beta agonists. D. Diazepam or morphine sulfate 4. Answer: B. Any drugs via the IM route. Explanation: intramuscular injections can injure muscle tissues, causing the release of enzymes that may mask the cardiac enzymes that are looked for to confirm a diagnosis of MI. 95. Your patient is a 67-year-old male who is complaining of chest pain. The chest pain continues after 2 doses of nitroglycerin. He reports a history of angina and says that all his previous attacks have been relieved by nitroglycerin. How should you treat this patient? A. Take a detailed history to determine why this episode is different. B. Treat the patient as though he is having an AMI and transport rapidly. C. Look for signs and symptoms of decreased perfusion or cardiogenic shock. D. Assume that his medication has expired and give 2 more doses from yours. Answer: B. Treat the patient as though he is having an AMI and transport rapidly. Explanation: a patient with angina whose pain does not respond to nitroglycerin is most likely suffering from MI and should be transported without delay. 96. What is the most common complication of an acute myocardial infarction? A. The onset of cardiogenic shock. B. Occurrence of unstable angina. C. The onset of a dysrhythmia. D. Increased intermittent chest pain. Answer: C. The onset of a dysrhythmia. Explanation: The most common complication of MI is dysrhythmia, and some dysrhythmias are or become life-threatening. Cardiogenic shock may develop following an AMI, especially when the site of infarction is the left ventricle. Angina is a cause of infarction, but is not a complication. 97. What is a side effect of using nitroglycerin? A. Hypertension. B. Bradycardia. C. Headache. D. Blurry vision. Answer: C. Headache. Explanation: nitroglycerin is a smooth muscle relaxant and can cause a headache because of its vasodilatory effects on blood vessels. The other three choices are incorrect. 98. A patient with a history of myocardial infarction reports experiencing a rapid heart rate and feeling weak after mowing the lawn. You should be most concerned about the possibility of A. Ventricular fibrillation. B. A CVA. C. Anaphylaxis. D. Left-sided heart failure. Answer: A. Ventricular fibrillation. Explanation: when a patient with a history of AMI reports a rapid heart rate and feeling weak after mowing the lawn, there is a possibility that the patient is experiencing a dysrhythmia. Left-sided heart failure occurs when the heart is unable to pump blood efficiently, resulting in fluid backup in the lungs. 99. As a patient suffers an acute MI, his coronary circulation becomes occluded. The result is ischemia, injury, and cell death to the myocardium. Ischemia means that the tissue A. is hypoxic but has not yet been injured. B. is hypoxic and already injured but still viable. C. has had its oxygen needs met by anaerobic metabolism. D. is viable as long as the pulse rate does not exceed 100 bpm. Answer: A. is hypoxic but has not yet been injured. Explanation: ischemia is the stage at which the myocardium does not have sufficient oxygen, but the cells are still viable and have not yet been injured.